Just a couple of notes on weight. The population as a whole had a high BMI at baseline. It was over 30. Most participants were really hoping that they would see a weight decrease, but unfortunately, both of our groups had slight mean weight increases. It was actually significant in the 16 KKW group. With respect to fitness, the high dose exercise group did have an increase in fitness, but the lower dose exercise group did not. When we looked at quality of life and psychosocial function, which were our secondary outcome measures, on all of our measures, with the exception of one, and that is the SF-36 physical subscale, we did see significant changes indicating improved quality of function and psychosocial function over time. Interestingly, the males and females, all males and females without a family history of mental illness, did not significantly improve on the physical subscale of the SF-36. So again, we're getting a little bit of variability when looking specifically at those subgroups. And I thought I would just briefly add some information about one of our ancillary studies that's currently in press. We were interested in looking at how exercise might affect brain-derived neurotrophic factor. It has certainly been shown to be decreased in depression, and treatment can increase and normalize levels with antidepressant treatment. But interestingly, we didn't find any change in BDNF overall, but what we did see is that folks who had a higher BDNF level at baseline, they seemed to see a more rapid symptom improvement. So we're looking into what this might mean, but it's certainly interesting, and again sort of indicates that there's a differential kind of effect for some folks with exercise. So conclusions, both low and high dose exercise augmentation did decrease depressive symptoms in the SSRI non-remitters we evaluated, and yielded remission rates that are comparable to antidepressant augmentation. We did see some dose-specific findings in that the high-dose exercise may be most beneficial to females without a family history of mental illness and to males, whereas low-dose possibly might be better for females with a family history of mental illness. But certainly we need to do future research to better understand and replicate these findings. But what's interesting and encouraging about this is it does, this information really does support the potential tailoring of the exercise program to the individual, which is an important treatment goal. In future directions, we certainly want to look at longer-term outcomes and whether participants will continue exercise, whether they've adopted exercise. We definitely want to explore more the data on dose response and the relationship between exercise and depressive symptoms, and further investigate mechanisms that can moderate treatment effects, both neurophysiological and psychosocial.